AM 1430 KRGI, 105.5 FM. Good morning. I'm Brian Gallagher, a guest in studio today. Teresa Anderson is here from Central District Health Department to bring us up to date on all of the things that we need to know, we think we know, and we should know. So first, welcome. It's good to have you here.
Good morning, Brian. It's good to be here.
So we get the changing viruses, the new variants, all of the things that are affecting our life. This Omicron virus, I think, has kind of caught us a little bit off guard. We thought we were making good strides against the previous variant, and we were. And then all of a sudden, here comes this, and it's just kind of knocked us around a little bit.
It has. What we know about this Omicron variant is that it's highly transmissible, so it really jumps from person to person. I want to tell you that so far this week, we have had 800 positives for the Central District. That's a phenomenal number, a very uncomfortable number for us, because that means that virus is just spreading like wildfire.
So the key for prevention is really doing everything you can to protect yourself, which helps to protect others.
The point is protecting others because, sure, it is your own responsibility to make those decisions on whether to wear a mask or not, whether to stay home when you're sick. But if we take it to the level where we're looking at how do I help others get out of this? What can I do to protect my mom, my children? And that's when wearing a mask and staying home when you're sick and social distancing becomes really important, and it seems like the right thing to do.
One thing in our business is we hear a lot of the news releases, not only from this area, but from around the country and around the world. And one of the indicators that has popped up recently is that there tends to be a spike in the infection rate, and then there's a quick drop-off. Are you seeing or feeling that around here?
We know that Omicron does that. It's on a really rapid increase right now here in central Nebraska. We expect to see an increase go through maybe the middle of next week, and then we do expect to see that sharp drop-off. It may stabilize for a couple days, and then we'll get back to whoosh, we're out of this.
So the previous vaccines that have been delivered, some in stages, and then there's the boosters too. The other indication I've had is that if you have been previously vaccinated, you're in a better position. If you're in the process of being vaccinated, don't stop.
Right.
Get it taken care of.
Right. What we know about those boosters is, and we're finding out as we go along, we probably never should have said 2 shots and you're done. I don't think we ever did say that, but I think some people felt like, I've got my first shot, I've got my second shot, I'm good to go. What we know now is that third booster keeps you out of the hospital and keeps you from getting really sick by about 97% increase in your ability to fight the virus.
Now, I have heard mention, right or wrong, about a potential 4th booster or an additional one beyond. Do you think that's real?
Yeah, I think what we're going to see down the road, what we're hearing is that there'll be another booster, whether it's the same formula in the vaccine or whether it's a new formula. We know that the scientists are looking toward what variants might be coming next. And we know that more variants will come. That's a given. We know the pandemic's not over just because we get through Omicron. But what we can kind of celebrate, I think, or look forward to is a very pleasant spring and summer in between surges. So what we have to do is take all the measures that we can right now to get us through, say, the end of February, 1 more month. And then we're going to have some free time where we can really open up and celebrate. And then at some point again, we're going to have to go back into everybody put your mask on, everybody make sure that you're up to date on vaccinations, etc. So that time will come again. We just don't know when.
All right. Are there scheduled next steps yet?
There are not, but what we expect to see, I expect to see, we had a booster. Some of us are going on maybe 6 months from our last booster. I would expect that before long we'll see the recommendation for a 4th shot or a second booster to get us through the next phase. And then after that, I think they'll probably be reformulating the vaccine to make it more able to handle the additional variants that we're going to see. As long as the virus can spread, it will spread. So until we can stop it, we're going to be in pandemic mode.
Teresa Anderson is the director of Central District Health Department here in Grand Island. We're getting caught up on the latest on Omicron and all the other things that are going on. And the other things are going on between flu shots and just the typical cold and flu season that comes this time of the year. And that's what is adding perhaps to the confusion.
Right. So what we see with the Omicron is a more of an upper respiratory. So it's the same, similar to a cold, very similar to a cold, and it also can act like the flu. So it's important to get tested, and we do have the testing going on 5 days a week through the NOMI Corporation, which does testing on our property. And they're doing both the rapid tests and the PCR tests. So if you're ill and you're not sure what it is, first of all, you can go see your doctor, and that's recommended, or your healthcare provider, or you can drive through and make sure it's not COVID. And if it is COVID, then you know what steps to take next.
Now, I know there was a rush recently, so it was creating some long lines and headaches. Are you still recommending appointments?
Yeah, NOMI has had some trouble because they had to change the way they were processing the rapid tests, and that structure just couldn't keep the temperature between 60 and 80 degrees where they needed for the reagent to make the test accurate. So what they've done now is added some heaters. We are helping them with staff, actually. We're providing swabbers today. They had 2 people that didn't show up, so we've got 2 swabbers out there to assist, because we're making every effort to give anybody who wants a test, and they're able to get a test.
Okay. A lot of things still going on, a lot of unanswered questions, but the work continues. If folks do have a question, what's the best thing for them to do?
They should call Central District Health Department, 308-385-5175, or we have a lot of information on both our webpage, cdhd.ne.gov, as well as Facebook.
Teresa Anderson from Central District Health Department, thanks for the update.
Thank you, Brian.
Good morning from AM 1430 KRGI 105.5 FM.